Hello, everybody. Good morning, good afternoon, wherever you might be. My name is Josh. Glad you could join us for today's webinar, Maximizing Health and Safety in the Workplace. We've got a great presenter. I'm going to turn it over to Kara very quickly here. Just general housekeeping items. We will be sending out the recording and the slides in about 24 hours, so keep an eye out for those. And with that, we've got a lot of content, so I'm going to kick it over to Kara. Kara?
All right, thank you. Hi, everybody. Good to be here with you today. We are going to be talking about COVID-19 still, forever and always, and what you can do to make the workplace as safe as possible under the circumstances. This is pretty similar content to webinars we've done on this topic in the past. It's still relevant. It's still good to hear again. Hopefully you can pick up some useful tidbits as we go through this today. Our agenda is to do some general talk about some general things related to making the workplace safe, so specifics that you can implement in your workplace. Then we'll talk about managing individual health for employees. We'll talk about dealing with a diagnosis. So if somebody in the workplace, has a positive COVID-19 result, what do we do about that? And then we'll spend a little time talking about sick leave policies and emergency paid sick leave, which is the federal program under the Families First Coronavirus Response Act. Okay, making the workplace safe. So first things first, masks are a good idea. This is an element of personal hygiene, personal safety for each employee. Many of us, of course, are in states where masks are required in indoor spaces right now. So, this might be a bit of a moot point, but many of us are also not in places where they are required. So if they're not required in your location, I would definitely encourage you to have employees wear masks in the workplace. It's just sort of an easy thing that we can do to make the space safer. If you are requiring them, either of your own accord or because the city or the state makes you do that, you should provide them. So I know at this point we're deep into this thing, 6 months in, 7, 8, who knows. So most people have their own masks. They've picked out the style they like and they're pretty attached to it. But some people haven't, or their mask wore out. They need something new. They'd prefer to wear a disposable mask at work. You definitely want to be accommodating that. Thankfully, masks have gotten much easier to find. So if an employee asks you for a mask because they have to wear them at work, that is something you should provide them. I'd also encourage you to have extras available for customers. If you do have customers and clientele, coming in and out of your workplace, it's a good idea to have those around, obviously, particularly if they're required. If somebody shows up and says, well, I don't have a mask, it's very easy to sort of diffuse that problem if you can just hand them one. I would recommend making a written policy and enforcing it. We do have a policy like this available for you. It's just easier to enforce any policy that's in writing. So it doesn't have to be complicated at all. It can be a sentence, but just make sure that employees are aware of that. I say if it's necessary or helpful, pick a scapegoat. You definitely see it when you enter retail establishments. The signs say, due to local ordinance, all customers must wear masks. And if that makes you feel better about making employees wear masks, oh, the CEO requires it. Oh, the city requires it. I say go for it. If you are going to blame it on another employee, though, like, oh, HR is requiring it, make sure that HR or whoever you're pinning it on knows that you're going to do that ahead of time and is okay with it. One thing I have added to this bit is to not make employees enforce masking rules. We've seen the problem since the beginning. There will be some clients or customers who do not want to wear a mask. And while your employees, you can certainly say, ask people to wear masks. Don't make your employees the police force here. We've seen violence. We've seen very bad reactions. Just the other day, my mom witnessed a guy, at a lunch counter come around behind the counter and spit in the face of the employee who had asked him to wear a mask. So we don't want to be putting employees in a position where they're going to get beat up or killed or spit on or anything like that. So if a customer or a client comes in and they're pitching a fit about wearing their mask, don't put it on your employees to solve that problem. We also want to think about hands. So we want clean hands. We want our employees to have clean hands. One of the number one things we can do is have employees wash as soon as they get into the workplace. So we don't know what they've been touching beforehand. We don't know if it was their nose or their mouth or, their children's nose and mouth. So just washing as soon as people enter a new space is always sort of good protocol. You can also schedule regular hand washing throughout the day. That the the goodness of that idea increases with customer and client contact. So if your employees, are working with the public, then more frequent hand washing should be implemented. What I would recommend is staggering that somehow. If you send everybody to wash their hands at the top of the hour, you're going to have long lines at the sinks, and it's going to be harder to maintain social distancing. Definitely provide hand sanitizer if frequent hand washing isn't possible. So for instance, let's say you've got delivery drivers, they're not around a sink with soap all day long. So make sure that they've got a, industrial sized bottle of hand sanitizer in the car with them. Likewise, just spread throughout the office or the workplace is a good idea, as well as anywhere that somebody can't avoid a touchpad. So if they need to use a touchpad to pay, or your employees need to use a touchpad to get in, as building security, having sanitizer available there is a good idea. And of course, we want that to be, 60% or more alcohol. As for surface hygiene, we want to make sure that things are clean, right? So provide disinfecting wipes if you can find them. If not, that's fine. They're still a little hard to come by. But you can provide other cleaning supplies. There's a list of products that kill this virus put out by the EPA. It's a very long list. It's got some things on it that might surprise you. And if you search COVID list N just on a wide open Google search, it'll come right up for you. When it comes to cleaning, we do want to make sure that that is scheduled. So, it's somebody's job to do that and make sure it happens. Don't rely on employees to be good citizens and clean something after they touch it. Just make sure that that's happening on a regular basis. Somebody chatted in a very good point, which is be careful of mixing chemicals. So you wouldn't want to, for instance, what is it? Bleach and there's something else. Anyway, these things can get very, very toxic. So pick one product off this list and use it. Don't be mixing and don't be getting creative because that can go really badly. Thank you to the person who chatted that in. I also think it's bleach and ammonia. Yeah, okay, I almost said that. Thank you. Don't do that. No bleach and ammonia. All right, so I also think it's not a bad idea to mark high-touch surfaces just to bring attention to them. So for instance, let's say you've got a water cooler. I know at the very beginning of the pandemic, people just shut the water coolers down, but okay, we're in this for the long haul now and people need their water. So presumably many of those have been, opened back up, but they still have that button that everybody touches throughout the day. So if you mark that with a little sticky note with that little arrow, the little red arrow that says sign here or something, just to bring people's attention to the fact that they've touched something that a lot of other people touch, that can be helpful. You could also put a box of Kleenex there so people can, grab a Kleenex to put over their fingers when they need to touch that particular button. So, there are things we can do to make those high-touch surfaces safer, basically. We can also try to get rid of them. So again, kind of in this for the long haul right now, not a bad idea to invest in some things that will eliminate touch points. So if you've got doors to rooms that don't need to be closed, prop them open with a doorstop, easy peasy. You can make a doorstop out of a wadded up piece of paper too. So that's super low effort. There are ways to get doors to open without touching the handle. One of those is actually just a little foot pull. So it's like a little L-shaped bracket that you put at the bottom of the door so somebody can push down with their foot and pull the door towards them without using their hands. So not everything has to be expensive again. I think you can get motion activated soap dispensers for probably less than 20 bucks on Amazon. There are lots of things we can do to reduce touch points, so keep those in mind. If you are open to the public, you've probably done most of these things already, but you want to, consider whether you can stagger customer flow or make, areas one way, so there's one directional traffic. You can, of course, mark the floor to assist with distancing, remove furniture to reduce capacity. Set up touchless pay systems. The fewer touches on a keypad, the better I feel about going to a place. So that's something to keep in mind. And then do provide hand sanitizer at the door. I would say on the way in and the way out if you have separate doors. That will in part make your workplace safer. And as for the sanitizer that's on the way out the door, that's going to make people feel better and safer coming to your establishment, if that they know that they can walk out and grab that hand sanitizer, and sort of feel better about their visit. If you have a sort of classic office space where people are just sitting around indoors all day at desks and computers, the number one thing we can do is let people work from home. Still a good idea. Maybe they can't work from home all the time, but as much as possible, if we can keep them in their own home and not bring them into a shared workplace, that's a good idea. Stagger shifts if you can. Change seating arrangements. So if you've got open desks that you can send people to, go for it. If you've got break rooms, unused offices, lobbies, courtyards, even if you're in a place with nice weather, courtyard season's kind of over where I am, but in some places that may exist year round. Get creative. We don't have to have people necessarily at their desk all the time. If you can't, however, spread people out well enough, consider installing barriers. And like I said, I know a lot of you have been sort of business as usual for months now, but there are still companies that haven't reopened yet. So, this is still on the list of things to consider upon reopening. Also, sort of an easy thing to maybe pick off is making it so employees aren't facing one another. So if you previously had desks that were, pointed at one another, just arrange them differently so that people aren't looking into one another's faces. As for meetings, you have probably found a system that works for you by now, but here's a small assortment of programs that you can get for free. So all of these are available in some capacity for free. They may have limits on how long you can use them or how many people can join, but they're definitely out there. So if you haven't figured it out yet, or you're looking for a new program, these are all possibilities. If you absolutely have to have an in-person meeting for some reason, it just seems super essential, then we want to make sure we're holding it in a large, well-ventilated area. We do not want to cram people into a small conference room. We want to find a big conference room, or maybe we want to have it in the lunchroom. Set up chairs ahead of time. Don't count on people to know what 6 feet looks like. If possible, make your entries one way in and one way out if there are 2 entries. No, that's definitely not always the case. Make sure pathways are wide enough so that people don't have to dance when they're passing each other to get in and out. And finally, do make sure that you're recording or simulcasting these meetings, inviting people via, FaceTime or whatever, if they can't attend in person. So I know a lot of people right now are working from home as a reasonable accommodation under the ADA, because it's basically too dangerous for them to be in a shared space. Those people should not be excluded from company meetings because of that fact. So, it is not hard to bring someone to a meeting via FaceTime. I did it just the other day. I brought someone to a credit union board meeting on my phone. Worked out great. They even got to vote. So, this should not be a real limiting factor. There are some things to consider if you are in that boat where you're reopening your office for the first time in 6 months or 8 months. We do want to be thinking in particular about mold and Legionella. So both of these things happen when we haven't used the space in a long time. Mold, you want to check for that, basically. Probably bring in a professional. Of course, many of the people on this call are not in charge of their buildings. They're, renting a building. So, take it to your building manager or the property manager and say, are you doing these things? Are you making it safe? This is definitely somebody's responsibility to check for mold and to clean it up if it's discovered. You also want to make sure you're running the water systems for a while, basically flushing the systems to mitigate the risk of Legionella. So that's something that grows in standing water and can be very dangerous. The CDC has really specific guidelines for dealing with Legionella, or being preemptive, being preventative about that. So if you are about to open your building or in the next few months you're planning to do that and you've been shut down for a while, definitely check out coronavirus building water system. That's going to take you to a CDC page with all this information in detail. I don't know why they call it building water system, because it's definitely about mold as well. But that's a great page if you are responsible, or if you want to, talk to your building manager and sort of have some talking points about the things that you're concerned with. We also want to improve building ventilation if we can. Once again, this may not be on you, but it's a conversation you can have. So we want to improve air filtration. Let's get some HEPA filters. We want to increase the percentage of outdoor air, if the outdoor air is safe, of course. If you are surrounded by wildfire smoke, or you are next to, a plant that puts off some kind of horrible, toxic smoke, then that might not be the best plan. But in most cases, the outdoor air is going to be preferable to indoor air. Open doors and windows if you can. I know the weather's turning in a lot of places, but that's remains good advice if you can stand it. We want to increase total airflow, and we want to consider whether we are pumping air from a clean space to a dirty space or vice versa. So basically, you don't want your air intake to be in the very, very busy lobby. We would want to sort of re-engineer that if possible. So again, probably not your job, but something you can check into. All right, let's talk about managing individual employee health for a bit now. So, months back, it was like, all right, so should we start taking temperatures of employees and asking them questions on the way in? And the answer seemed to be yes. But then shortly after that, we had the novel idea that maybe we should just have employees check themselves at home before coming to the office at all, because keeping those sick people, out of a communal space is really the best idea, definitely a better idea than checking them at work. So do that first. Make sure that your employees are considering how they feel each morning before they come to work. This is the sort of common but longish list of coronavirus symptoms. So this is something you can share with employees and say, hey, if you're feeling any of this, stay at home. We can talk about, working from home, telework, whatever, changing your shift, moving your hours, whatever. You can have them take their temperature at home, always a good idea. If they don't have a thermometer, you could buy one for them. They are quite inexpensive, under $10, probably a good investment. Some best practices for temperature taking is that you should wait at least 30 minutes after exercising. So this is just information that you can share with employees, whether they're taking their temperature at home or whether they will also have to get in line at work to have their temperature taken again. These are things that are going to get you better results. So 30 minutes after exercising, and wait at least 4 hours after taking a fever reducer. Of course, if an employee is taking a fever reducer for a fever, we don't want them even considering coming in. But if they're taking, ibuprofen for sore muscles, like I constantly am, then, wait 4 hours. The CDC is still using the number 100.4, but that's like the upper limit. You can make it lower if you want. They actually recommend 100 for healthcare facilities, but you can set that wherever you want as an employer. My body temperature is usually like 97.6. So if I personally were to be 99 degrees, that would be hot for me. And I would be telling my employer, hey, I'm not 100, but I'm hot enough to stay home. So you can certainly be flexible with that. If you are going to take temperatures when employees come in, which is a good idea, you want to make sure that both parties have masks on, the person who's having their temperature taken and the screener. You should provide goggles or a face shield for your screener as well. You know, this is probably the highest risk position in your company right now, the person who has to do the screening. So we want to give them all the tools available to feel safer about that. We, of course, want to maintain social distancing until absolutely impossible, you know, if you need to get within that 6 feet to take their temperature. If they're using something that, like if they have to reach out and touch the employee they're screening, we want to make sure that they can wash their hands, change their gloves between each employee that they have to touch. If not, if they don't have to touch anybody, fantastic, that's ideal. But they should still be able to, you know, wash their hands or do whatever they feel is necessary to sort of stay safe during this process. A couple of you just asked if the deck will be available after the session. It absolutely will. We will mail you both the deck and actually a copy with all the audio of the entire webinar within about 24 hours. So don't feel like you need to take copious notes on this. A really important thing with temperature taking and other screening is that you need to keep the results confidential. So, you know, somebody asked me a month ago, they said, oh, I've got a book at the front and we have employees take their own temperature and then, you know, write their temperature in the log. Not recommended, not really ADA compliant. So we want to make sure that we're keeping it a secret, even though a temperature doesn't seem like much of a secret under the ADA, that is protected medical information. So we need to make sure that that is not shared, not stated out loud, not written in a book that everybody can read, etc. And there's a page that you can find by searching CDC General Business FAQs that just has tons and tons of good info. You know, we've been here a while now. We've been dealing with this. The CDC's website has gotten better and better. So there's a lot of good info on their webpage, and I would definitely point you that direction. Somebody asked, do you need to record the results or can we just say okay? That is a great question. And I would say check state law on that. Some states are actually requiring that you do the temperature checking and that you keep the records. I definitely had sort of the instant thought that we should just approve people and not write it down. That's probably how I would prefer to deal with it. You know, that's the easiest way to keep it confidential. But I have definitely seen some state and probably local ordinances that say, you know, checking is required, and if you are checking, you need to maintain that information because of course it can be useful to like a contact tracer in the future to see like who had a temperature when, on what day, how long have they been sick for. So yeah, definitely check state or local law to be sure that you could just say, all right, you know, let yourself in. There's a decent chance that that's actually something you need to record at this point in time. Somebody pointed out that they're using their state more because the CDC is a little back and forth on their advice at times. I totally hear you on that. If your state has a good website, a good health resource, even if your city has a good health resource or health authority, definitely lean on that. And I'm going to give that piece of advice a few slides down the road. For instance, if somebody in your workplace does become sick with COVID-19, I say call the local health department and get their help. So yeah, I think some states and some cities don't have great resources, in which case the CDC does have a lot of pretty good info. But if you can find more local guidance, then by all means go for that as well. If you ask about employees' symptoms, you do need to keep that to specific to COVID-19, and you also need to keep it confidential. We don't want to be doing a wide open medical exam, which is what that will become when people, show up at work in the morning. So, use that list that was on the slide a few slides back and say, are you feeling any of these things? You could have that written down on a piece of paper that employees can see when they're waiting at the check-in line, and you can say, do you feel any of the symptoms on that list, right? You don't need to stand there and read them to every single employee. There are definitely ways to do this. And of course, we want to keep that confidential as well. One of you asked, we have a book where employees write down their temperature checks. What do you recommend instead? I would have employees email you, have them, write it on a sticky note and put it on your door. Come up with, I don't have a perfect solution for that. It really is going to depend on your particular circumstances, but the book is not a good idea. So you'll need to problem solve that a bit. We also need to think about reasonable accommodations. This is a little bit of a topic switch, but it's still under dealing with individual health. We need to think about reasonable accommodations for employees who are high risk. So if someone comes to you and says, I really can't be in a shared office space right now because I have diabetes or heart disease or asthma or whatever, you don't want to blow that person off and say, we need you at work. They have basically triggered the Americans with Disabilities Act, assuming you have 15 or more employees. And that means you need to engage in the interactive process with them to see if there is a reasonable accommodation that you can provide. Once they've asked for an accommodation and you're in this interactive process, you can ask for a doctor's note to sort of prove that they have an issue, right? That is okay. I want to point out that if you're under 15, the ADA doesn't apply to you. However, a lot of states have disability laws similar to the ADA that kick in at a smaller employee count. So, it's possible that there's basically a state ADA that starts at 5+ employees. So don't think that just because you're small, none of this applies to you. It's very possible that there's a state law that sort of fills in the gap. One of the questions we got a lot early on, seems like we're getting it a little bit less now, is whether you need to accommodate someone who has a vulnerable family member. Technically, no, the ADA does not require that sort of second degree of accommodation. You only have to accommodate the person who actually has the disability. However, I would strongly encourage you to accommodate the person with a vulnerable family member in any way you can. It could be an extended unpaid leave. It's not that you have to pay them indefinitely or anything like that. The ADA doesn't require that. But if you just don't like people working at home, but they're capable of working at home, that would definitely be something you could offer them. We don't want to be responsible, right, as employers for the fact that someone took COVID home and killed grandma, right? It's sounds dramatic, but it happens. So do what you can to be a good employer, to be compassionate and empathetic under the circumstances. All right, let's talk about dealing with a COVID-19 diagnosis in the workplace. If someone is diagnosed, when can they come back? This is sort of the #1 question. Well, we really want sick employees to work with their healthcare provider to determine when to return. Generally, though, the rule is going to be something like this: at least 24 hours since recovery, meaning they don't have a fever and they haven't taken any fever reducers, and their other symptoms have improved. As well as 10 days have passed since symptoms first appeared, or since there was a positive test result if the employee is asymptomatic. So let's say you've got an employee who comes to the office and they feel fine, but the next day they call and they say, hey, I'm getting a COVID test because somebody in my family has it now. We don't want them to come in while they're waiting on the results, and then once they get the positive result, even though they're asymptomatic, we're going to have them wait 10 days. If you have an employee come in and they are lightly symptomatic, let's say they're coughing a little bit, you send them home, they get a COVID test, and then the next day they feel perfectly fine. We need to do this 24 hours since recovery, but we also need to do the 10 days. So both of these boxes need to be checked. Just because someone is mildly symptomatic and recovers right away doesn't mean we can let them right back in. People are perfectly capable of spreading this while asymptomatic, or when it seems like they have recovered. Someone asked, don't you have to require a negative test result before they return? No, and in fact, the CDC says you shouldn't. And I believe the state of California says you cannot, at least under certain circumstances. So testing is not suggested as the method to determine when someone can come back to the office or enter regular life. The CDC is recommending a symptom-based approach or a time-based approach. This is for a few reasons. One, tests are kind of hard to get right now. Two, healthcare providers are busy. So writing a note and providing multiple tests and all the rest is just not particularly practical. Also, the tests often indicate that someone has coronavirus when they are no longer capable of spreading it. So that has been a problem, that basically the tests are too sensitive. So someone may be well past the point of being able to spread it, but a test result says they still have it, and so we're forcing them to stay home and lose income and sort of stay out of the economy, and that is not good. So no, please don't rely on a test or require a test for them to come back, for all of those reasons. Have them work with their healthcare provider and use a symptom-based or a time-based approach to return. There was a follow-up, can our company require it? It depends. Like I said, I think California has actually limited the test requirement. I know we've got people from all over listening in right now, but other states may have done something similar. Technically, yes, unless state law or local law says otherwise, but it is strongly discouraged for all the reasons I just mentioned. Do we need to tell other employees that they may have been exposed to that sick person at work? Yes, you do, but you're not going to tell them who specifically is sick. So we do need to tell them that they were potentially exposed, but we're not going to tell them that it was, Jim in accounting who has coronavirus. Employees probably won't like that because they won't be able to gauge their own risk level, but dems to breaks, that's the rule under the ADA. We cannot share that type of information. That is confidential. Here's where I say call your local health authority for help assessing risk here, right? So you can call up and you can say, hey, somebody in accounting, Jim in accounting, they'll probably can give them Jim's name, has coronavirus. Who should I tell? Who needs to quarantine? And you can walk them through who sits how close. How long do they spend with Jim? What are the circumstances of all of this? When was Jim in the office or not in the office relative to his symptoms and his positive test and all the rest? They can help you sort through that, so you can help employees determine whether they need to be quarantining or whether they're just totally fine to keep coming into the workplace. So, like I said, you may be wondering, do exposed employees need to quarantine? The health authority, health department can help you figure that out. The general rule right now is if there was close contact for a prolonged period of time, the exposed person should quarantine. So the CDC hasn't been able to precisely define these terms just because there hasn't been a way to test it really, but they're going with 6 feet and 15 minutes, regardless of wearing masks. So if both employees are wearing masks, but they're standing really close together, maybe in a retail setting, stocking shelves, or they're on a production line or something, then we probably need the employees who are within that 6 feet for 15 minutes or more to go ahead and quarantine. If you've got someone sitting 2 or 3 cubicles away, or a totally different corner of the building, probably quarantine is not going to be necessary. But again, hopefully the local health department can help you figure that out. So the CDC does provide some guidance for disinfecting areas that have been used by an employee diagnosed with COVID-19, because that is important as well. I'll skip to the bottom bullet first here. If it's been more than 7 days or 7 days or more since the person who is sick was in the workplace, you don't need to do anything special. So let's say somebody has been out on vacation, for a week and a half, and they call and say, oh, hey, I was diagnosed with COVID-19. You don't need to do any special cleaning of their space because they haven't been there for 10 days. And we basically don't think the virus lives on anything for that long. So good to go on that one. However, if they were there more recently, we want to close off the area they used, if at all possible, for 24 hours. I know that's not practical in many cases, but if it is, please do it. Open outside doors and windows to increase air circulation if that's not something you're doing already. Wait as long as possible before you clean or disinfect. Basically, the longer you can wait, the more of the virus is going to die off, so the lower risk to the person who has to do the cleaning. And then make sure you're getting all the areas that they could have used. Don't just think about their desk, but think about where they walk in the building during the day, or their register. So they've been using the bathroom, they've been using maybe a break room. If there are touch screens that multiple employees use, keyboards, try to sort of walk through their day as an employee and make sure you're cleaning all of those spaces. If you need to vacuum, there's additional CDC guidance about that. So check it out. Hopefully, if you've got a cleaning crew, that's something that's on their radar, but you may want to tell them, you should tell them that, hey, tonight you'll be cleaning an area that is potentially infected with COVID-19, so they can, well, not with COVID-19, with coronavirus, so they can take appropriate measures to protect themselves. As for employees who are only potentially, maybe, sort of, could have been exposed because they did something kind of risky, as an employer, it's sort of up to you if you want to start enforcing quarantines when people just engage in risky activities like travel, or going to a party without social distancing and without masking. You can pretty much make any kind of rule you want. But if you're not inclined to have someone quarantine just because they did something risky, but you don't know that they were exposed, you can instead double down on sort of the regular suggestions. So this is actually a bulleted list of what you would do with an essential worker, like in a healthcare setting, who you knew was exposed. So, a nurse, let's say, who's working with COVID-19 patients who are coughing constantly, she's in a continuous state of being exposed to COVID-19. So these are the things we would have her do to protect others. So really, this is the stuff that I've already suggested elsewhere in the webinar. It's not really novel, but you definitely want to be serious about those things if you are letting someone work who you think has engaged in risky behavior. Again, really up to you how you want to deal with risky behavior. Some employers are not worried about it. Some are very worried about it. In many cases, employers are worried about it because other employees are worried about it. Let's say an employee, takes a trip to Georgia, they go to a family reunion where no one is wearing masks at all and there isn't any social distancing because that employee is not particularly worried about coronavirus. Other employees know they did that and they feel really paranoid working around them because, that was sort of high risk activity. So you could ask the employee who traveled potentially to quarantine if you'd written a policy to that effect, or you could, again, have them do these things on this list, and be really serious about it. Okay, let's talk about sick leave policies for a bit now. My biggest piece of advice is to make your sick leave policy as standard and well enforced as your attendance policy. What do I mean by that? I mean, if someone comes to work sick, they're in trouble. When someone fails to come to work, or comes to work really late, we bust out the attendance policy and we say, you are subject to discipline for violating this policy. And the same should go for your sick leave policy. It shouldn't just be about their entitlements. It should be about don't come to work sick. And that's sort of a shift for a lot of employers. In America, we sort of consider it a badge of honor to come to work sick and be a trooper. It's being a workaholic is often considered a good thing here. In other cases, it's the employer who's sort of making people come to work even when they don't feel well, because that's just sort of just how it works. I think in food service, that's extremely standard that people will come to work sick, even though that sort of horrifies a lot of us who eat the food that's being provided and interact with those people. But anyway, we need a change of attitude about that, right? We don't want people to be good soldiers. We don't want people we don't want managers making employees come in sick to protect the bottom line. It's just too risky. So change your attitude and make sure that your attitude sort of flows down to other people in the company. Make sure your middle management sort of understands that they are not supposed to be dragging people into work when sick. If you have attendance incentives for individuals or for teams, definitely suspend them. So, some companies will say, hey, if everybody has perfect attendance on your team for 1 month, you get a pizza party. Get rid of those, because we don't want to be encouraging people to come in sick. And then make sure your call out policies are reasonable. I've seen so many sick policies or attendance policies that say you have to call us 24 hours ahead of time if you're going to be out sick, but that's not how sickness works. And, if you've got an employee with COVID-19 who wakes up feeling bad, but your call out policy says they have to give 24 hours notice, they're going to drag themselves in so you can take their temperature and then, send them home, just so they don't violate the policy. But now we've just massively increased everybody's risk. So, check your call out policy and make sure it actually works for illness and says something like as soon as practical, or as soon as you won't be able to make it to work, as opposed to, some number of hours like 4 or more starts to become unreasonable, particularly for morning shifts. Do check state and local law. So if you are in a state or a city that already had some kind of paid sick leave, there's a decent chance it's been amended and expanded to cover other COVID-19 scenarios. Like certainly having COVID-19 would make you sick, so you'd be able to use sick leave under any state law, but often they've been expanded to include caring for others, caring for children, so you can check that out. These leaves are generally on top of what's provided by emergency paid sick leave, the federal entitlement, which I'm going to talk about next. So make sure you're aware of those dynamics. Additionally, those are going to be the EPSL, the emergency paid sick leave under the FFCRA, is going to be in addition to anything you offer out of the goodness of your heart. So let's say you have always offered 40 hours of paid sick leave. When the FFCRA came out, it added 80 to that. It doesn't mean you could get rid of your policy. It doesn't mean you could reduce the FFCRA by 40 hours. FFCRA is on top of whatever you provide. I think by now most employers have heard of it and understand it and probably had to use it. But just in case you're not, here are some of the high-level details. It applies to all private employers with fewer than 500 employees, and there are no exceptions for small employers. There are some potential exceptions to childcare for employers with with fewer than 50 employees, but there are no exceptions for EPSL. If somebody is sick or needs to take care of somebody who's sick, they get to use it. It doesn't matter if you only have 2 employees. You do get to take the cost of this right off the top of your payroll tax bill, though, so it's not ultimately coming out of your pocket. EPSL can be used when an employee is subject to a quarantine, when they've been advised by a healthcare provider to self-quarantine, or when they're seeking diagnosis for symptoms of COVID-19. It can also be used to care for someone who qualifies under number 1 or 2, or to care for a child if their school or place of care is closed. Full-time employees who do 40 hours or more per week will get 80 hours. Part-time, it's prorated. When caring for themselves, employees are going to receive 100% of their regular pay, up to $511 a day. If they're caring for others, it's going to be 2/3. Leave doesn't have to be taken all in one chunk, but it can't exceed 80 hours. So if somebody takes 40 hours now to care for grandma, and 2 months from now they have COVID-19 themselves, they'll still have 40 hours left to take care of themselves. EPSL under the FFCRA requires fairly limited documentation, and employers cannot require more than the law allows. So you can't ask for a doctor's note. You can't ask for a positive COVID-19 test for them to take FFCRA leave. You can only ask for the things on this slide. So their name, the date they need leave, the reason they need leave, and a statement that they are unable to work because of that. For quarantine orders, we're also going to get the name of who told them to quarantine, or the name of the healthcare professional. Not a note from them, just their name. And keep in mind that you can do even more than this. You can have a policy that allows time off for any illness. You know, if the FFCRA, if EPSL is your first introduction to sick leave, feel free to use that as a springboard to sort of learn how to provide sick leave as a general benefit. Limiting the spread of all viruses, including the flu that is about to be upon us, and allowing sick people to fully recover at home is going to reduce risk all around and make your employees and your customers feel safer. All right, thank you all so much for joining me today. I hope that was helpful. Once again, we will send you a copy of the presentation as well as the slide deck within about a day. Thanks, have a great one.